Hi, I'm Maggie. I'm a physician assistant here at Midwest Breast. And I'm going to talk to you now about activity restrictions following surgery for implant placement, implant removal, any type of revision surgery done in an outpatient setting after DIEP flap, or basically any revision surgery where it's kind of that second go around, and even for reduction. So a lot of these restrictions are the same for all of these surgeries since we're working in the same area. So you'll hear me say the word 4 weeks a lot because that's your recovery time. So 4 weeks is what we expect you to take it easy, to avoid strenuous exercise. During that time, we want you to avoid lifting more than 10 pounds, like a milk jug, for about 4 weeks. We want you to avoid using big repetitive arm motions, like vacuuming and rowing type motions, for 4 weeks, because that activity will cause you to generate fluid, which could delay you getting any drains out if you have drains. And also we want you to avoid doing a lot of reaching overhead or bringing that elbow up above your shoulder level. Primarily though, that number is for about 2 weeks, as far as bringing that elbow up. And the reason for that is, again, we want to avoid any excessive pulling of the stitches that may be on the outer part of the chest wall. So we obviously want you to avoid doing any strenuous exercise or high impact activity like running or jumping for about 4 weeks. But in general, we do want you getting up and walking at least every hour after surgery, which is very easy to do with these type of surgeries. You'll be up and moving, no problem. And we do encourage walking, just to decrease your risk for blood clots after surgery and just to kind of improve your overall mobility. One common thing that we hear is, can I sleep on my side or stomach? And the answer is we want you to sleep on your back for about 4 weeks to really let everything heal well and to avoid extra tension or pressure on those incisions. You can return to work generally after about 4 weeks for most of these surgeries. So oftentimes I'll hear the question, when can I go back to work? And for an outpatient surgery where you go home the same day, generally most people are back to work within a week. If you have a more strenuous job, like a factory type job or something where you're doing a lot of really heavy manual labor or repetitive arm motions, sometimes we will keep you off of work for up to 3 to 4 weeks. And that's kind of very specific, and we'll work with you on that if you have a more strenuous job. But again, most people, if it's a desk job or something a little bit more sedentary, you can be back to work within a week. Sometimes we'll extend that up to 2 weeks for like a reduction.